Hello, my name is Robin Newmeyer, and I am a DNP student at Old Dominion University and the moderator for this group testimony. The topic we would like to discuss with you is regarding sleep health. Sleep, like nutrition and physical activity, is important to assure a healthy lifestyle. The negative effects of the lack of or poor quality sleep can not only be harmful to you, but to those around you in the form of drowsy driving. Researchers estimate that more than 70 million Americans suffer from a sleep disorder, and one of those consequences is driving drowsy. Sleepiness can impair driving performance as much as alcohol. You will hear in a minute how sleepiness causes more accidents than drunk driving. Now you will hear from 5 of the professionals who will discuss points of view from the nurse practitioner, the population, awareness to legislators, policy, and costs associated with health care. Poor sleep health and drowsy driving is a serious public health issue and why it merits attention, education, and immediate action from legislators. We ask for legislators to support the Drowsy Driving Reduction Act and their respective states to make driving safer for everyone. Thank you.
Hi, I'm Janice Kitts and I'm a registered nurse. I would like to educate you on the importance of sleep health and the health cost associated with inadequate sleep from the nurse practitioner point of view. Sleep, like nutrition and exercise, is a critical determinant of health and well-being. It is a basic requirement for infant, child, and adolescent health and development. Sleep loss and untreated sleep disorders can influence basic patterns of behavior and have a negative impact on family and interpersonal relationships. Fatigue and sleepiness can decrease productivity and increase the potential for medical errors, motor vehicle accidents, and industrial accidents. Obtaining adequate sleep is necessary to fight off infection, perform well in school, and work effectively and safely. It also supports the metabolism of sugar to help prevent diabetes. The amount of sleep and the timing of sleep impact endocrine, metabolic, and neurological functions that are critical to maintaining personal health. When left untreated, sleep disorders and chronic short sleep have been shown to be associated with increased heart disease, high blood pressure, obesity, and diabetes, all of which can lead to an increase in mortality. Sleep health is of particular concern for individuals with chronic disorders such as kidney disease, arthritis, Parkinson's, and epilepsy. The impact of decreased sleep on cognitive abilities among older adults can decrease quality of life. It is important to understand the importance of sleep health. The percentage of individuals in the United States who sleep less than 6 hours per night has significantly increased over the past 30 years. Competition between sleep schedules, employment, and lifestyle is an increasing trend. Sleep disturbances due to lifestyle choices are associated with temporary fatigue, disorientation, and decreased alertness. Sleep health education and promotion is needed to address the importance of sleep health among all ages and socioeconomic groups. Health education programs can increase awareness of common sleep disorders. Sleep health education programs in the workplace could lead to better scheduling patterns and thus promote health and safety for the employees. Sleep health is critical for promotion of good health and prevention of disease processes. The fiscal impact of decreased productivity and accident risk, both in the workplace and in motor vehicles, is significant. Advanced practice nurses need to work with clients to educate on the importance of sleep health and the risk associated with sleep disorders. I urge you to educate yourself and others on this growing concern.
My name is Shani Brown, and I'm a family nurse practitioner in the state of Virginia. I would like to discuss with you the fiscal impact of sleep disorders, the current objectives for Healthy People 2020 for sleep health, and emerging issues of sleep health in the United States. As previously mentioned, the fiscal impact of decreased productivity and accident risk, both in the workplace and in motor vehicles, is significant. Adverse effects on work performance are consistently ranked among the most prominent components of overall societal burden of sleep disorders. With insomnia alone, estimates of annual workplace costs due to asset sickness absence, reduced work productivity, and workplace accident injuries in the U.S. civilian workforce range between $15 billion and $92 billion. Daytime sleepiness, inadequate sleep time, insomnia, and other sleep disorders also place significant burden on healthcare systems through increased utilization. One report estimates that undiagnosed sleep apnea costs $30 billion annually and increased healthcare utilization and medication costs related to these comorbid health risks. The Healthy People 2020 has been increasing the public's knowledge of sleep health as part of its main topics and objectives. Current objectives include increase the proportion of persons with symptoms of obstructive sleep apnea who seek medical evaluation, reduce the rates of vehicular crash per 100 million miles traveled that are due to drowsy driving, increase the proportion of students in grades 9 through 12 who get significant sleep, and increase the proportion of adults who get significant sleep. In emergent issues, the Department of Health and Human Services has expressed that therapy for sleep disorders remains suboptimal, and the research workforce addressing sleep science is insignificant. The Healthy People 2020 initiative states that progress in the following areas will yield more information on sleep health over the coming decade. These include the further evolution of biomedical sleep research, quantification of health risks associated with untreated sleep disorder breathing across the lifespan, findings from the first U.S.-based Phase 3 sleep disorder breathing treatment trials in children and adults. Agencies such as National Center of Sleep Disorders Research are currently proposing research to advance biomedical knowledge related to sleep or sleep disorders and improve understanding of neurobiological or functions of sleep over the lifespan. They are also looking to enhance timely diagnosis and effective treatment for individuals affected by sleep-related disorders, or implement and evaluate innovative community-based public health education and intervention programs. And I thank you.
Good afternoon. My name is Crystal Okoye, a doctoral student at Old Dominion University. I am honored to speak to you today about sleep health and the awareness of drowsy driving and individual prevention of drowsy driving crashes. Sleep deprivation has severe effects on performance. Researchers have studied the implications of fatigue for safe performance, particularly in road safety. Fatigue, they argued, is most likely to occur when rest is reduced, such as when working long or irregular hours, doing shift and night work, or due to family responsibilities or lifestyle choices. A study by Williamson and Fayer found that the effects of fatigue play a part in between 16 and 60% of road accidents, and in the US were estimated to cost about $50 billion. The study revealed that impairments in performance, which have been judged as the legal limit for driving safely, may start to occur as early as 17 hours after waking and around 18 hours on average after waking. In the community, a 16 to 17 hour period of wakefulness will be regarded as normal, with bedtime typically occurring in the mid to late evening, depending on the time of rising. It could be argued, therefore, that this common pattern of waking and sleeping plays a major part in ensuring safety. If the period of wakefulness is extended beyond the usual 16 to 17 hours, performance is likely to be impaired sufficiently to represent a considerably greater risk of injury. Driving home after a long workday, for example, may present increased risk of an accident. Drivers who have been awake for more than 17 to 18 hours are then likely to be significantly slower at reacting and will be increasingly likely to miss information as the period of sleep loss increases even further. The overall implication of drowsy driving is clear. Sleep is needed after the end of a day if adverse effects on performance are to be avoided and road safety achieved. Many people remain awake for periods of 16 hours or more for reasons of work, family, or social life. These results suggest that after this duration of wakefulness, fatigue reaches a level that can compromise safe performance. Policies are needed that promote individual standards for fatigue to ensure that people who have had 18 hours or longer without sleep are kept from at-risk behaviors such as driving. Finally, a national policy that promotes the increase of drowsy driving awareness campaign can drastically reduce the incidence of this crisis by elevating prevention programs in the American public consciousness. Thank you very much for introducing and supporting a bill for drowsy driving awareness and prevention.
Hello, my name is Carmen Corder, and I'm an ICU nurse and an Old Dominion University doctoral student. I'd like to call your attention today to the critical need for increased legislation against drowsy driving. Despite thousands of fatal crashes each year, most states have no specific laws addressing drowsy or fatigued driving. The two states with specific legislation include Arkansas and New Jersey. But even these laws are largely symbolic and difficult to enforce. The state of Arkansas classifies fatigue driving as negligent homicide when a driver who has been without sleep is involved in a fatal crash. Probably the most well-known drowsy driving law was passed in the state of New Jersey. Maggie's Law was passed in 2003 and makes it illegal to knowingly drive a vehicle while impaired by lack of sleep. Drowsy drivers involved in a fatal crash can be charged with vehicular homicide. This law was the result of a campaign by Carol McDonald, whose daughter Maggie was killed in a 1997 car crash by a van driver who was smoking crack and had not slept for 30 hours. The driver got off with a $200 fine because the jury was not able to consider fatigue as a factor of guilt. In order to make a significant impact on the number of drowsy driving accidents, lots more people need to start thinking and discussing this issue. Laws are one of the most important tools with which to do that. A 2015 study found that the state of Massachusetts experienced 18% fewer overall crashes and 29% fewer nighttime crashes after enacting tougher penalties on nighttime driving, including drowsy driving in driver's education. Results such as this cannot be ignored, and thus it is imperative to address this critical issue with specific legislation and strict penalties for drowsy driving in all 50 states.
Hi, my name is Debbie Bucci. I'm a nurse manager in a community hospital in Norfolk, Virginia, and I'm here to speak with you about passing sleep legislation. Sleep is an essential building block for the health of our nation. Without sleep, the ability to learn and cope with everyday stressors is diminished. Adults who sleep less than 7 or more hours a night are at increased risk for heart disease, elevated blood pressure, obesity, diabetes, and other illnesses. Individuals with chronic health conditions or advanced age need adequate rest to maximize quality of life and coping. One of the most devastating results of reduced sleep is caused by working or driving while drowsy. Driving or working after inadequate sleep increases motor vehicle and employee accidents. My role as nurse leader makes drowsy driving particularly concerning. Shift work is required to provide patient care 24 hours a day. Night shift workers are more likely than day shift workers to skip sleep to meet family and social obligations. This lack of sleep puts them at greater risk for unintended harm to patients, self, and others. Organizations have been found liable for patient harm in motor vehicle accidents caused by employees working or driving drowsy after extended shifts. Ramifications from drowsy driving accidents range from personal financial loss and health issues to prosecution and death. Survivors experience regret and moral distress. Statistics indicate 1 in 3 drivers admit falling asleep behind the wheel. In 20% of fatal crashes, drowsiness was a factor. Sleep health was added to the Healthy People 2020 goals in an effort to create awareness and increase treatment for sleep-related disorders. To improve awareness and compliance with minimum sleep recommendations before working or driving, legislation is needed. Penalties for driving while drowsy create awareness and serve as a deterrent. We respectfully request your support of legislation against drowsy driving. Following the example of states like New Jersey, approving this legislation will increase consciousness about the gravity of getting behind the wheel or working while sleep deprived. The health and well-being of our nation depends on strong penalties for driving or working drowsy.
Thank you to our expert panelists in giving testimony in reference to sleep health and the negative consequences associated with drowsy driving. All the panelists encourage every state to support legislation laws against drowsy driving so that we may all be safe on the road.